Hey everybody, we're going to be using Kybella today with Laura Beth. This is going to be her second injection session. Kybella is a newer product. We've had it for almost a year now that's specifically indicated for treating a double chin. The way Kybella works is that it is a series of injections. Most people have about 2 to 3 injection sessions that we space 5 weeks apart. And what Kybella does is specifically acts on the fat cells that live underneath of our chin. The great thing about this product is that once you go through this series of injections, the results that you get are going to be permanent. And that's because when we reach adulthood, the number of fat cells that we have in our body is already preset. The reason we gain and lose weight is that the fat cells that we have get bigger and smaller. So if you take out that number of fat cells from a specific area, whether it's via liposuction, Kybella, or another product, those results are going to be permanent. Now that's assuming that your weight stays fairly steady within about 10 to 15 pounds. Kybella, as you'll see here, is a quick and easy injection to do. Most patients do have some significant swelling for an average of about 3 to 4 days. What we talk about is that those days will be swelling that you and other people will notice for that time frame of 3 to 4 days. And then it might be something that you see for a couple of weeks after, but it's not terribly noticeable for other people. Some folks find that wearing a turtleneck or a scarf can be helpful. We usually do these on a Thursday or a Friday, and most patients feel comfortable enough going back and resuming all their normal activities on a Monday. So what we'll do is we're going to do a demonstration here with Laura Beth of the actual injection. She's using some ice to numb the area. The injection itself is not painful. It doesn't hurt. You do feel the medicine as it goes in. It can be a little bit warm and tingly, so sometimes we put the ice right back on, but the injections go by really quickly, so the entire procedure is really pretty simple and quick. So what I'll do is we're going to mark out where we're going to be on the neck, and I just use an erasable marker. Look up for me, Laura Beth, a little bit. And we see where we're going to be. What I usually do is mark the bottom part of the jawbone here. We don't want to go above that line there. And then you can come down here, and this is called the thyroid notch, which is about where our larynx or our voice box is, and we make a mark here. And then, all right, put your neck in a normal position, and then what I do is see exactly where that little pooch is. So I know my boundaries, and really for Laura Beth, this is the area that we're going to want to be treating. Right in that little square, right there. Just like that. Good. You can put the cold back on for a second. We'll clean you off really good. I use a really small needle. It's a 33 gauge. It's one of the smallest needles out there. Of course, anytime we're doing an injection, there's always a risk of bruising. But fortunately, using all this ice, we rarely see patients who have bruising with this. If they do, it can be a little pinpoint bruise. That's usually easily covered up with makeup. And that's the exception rather than the rule. So, all right, Laura Beth, I'm going to steal this pillow from you. You can look up there. And what I like to do when I inject, I've got my markings right here in this area. I take a little pinch so I know where I'm going to be. And we just start going along, and we do 0.2 cc's each way. We space these out about 1 centimeter apart. So just a tiny little needle pinch here as we go along, right about 1 centimeter, spaced apart through our markings. There's one. This area is a big concern for a lot of patients, and I think being able to offer people something besides just liposuction and getting some permanent results has been really one of the things I really like about Kybella and what this product can do for folks without having to have potential complications of a surgical procedure. Just doing a series of injections like this that go by really quickly, and we're getting really good results with it. So it's been rather revolutionary. All right, just a couple more and then we're done. One here. How you feeling?
Good. Fine.
Awesome. Last few injections here. Good. And that's it. And you can see there's really no bruising. There's a couple of little teeny marks you can see, but that's it. No real bleeding or anything. There is a little bit of fluid in that area. Okay, you can put the cold back on. We used to inject that area with local anesthetic, but that added to the volume of fluid that we were putting there, and we found that just with this icing, it was really a lot easier for patients. And so, it goes by really quickly, as you can see. So what we say to folks is kind of take it easy for the rest of the day. You can work out and resume all your normal activities tomorrow. You can eat a normal diet. You can shower, do all those sorts of things. We have patients do some icing tonight and in tomorrow. If they have any discomfort, Tylenol works fantastic, as does the ice. But other than that, there's no real associated downtime or side effects with the medication. So, thanks for watching. We'll see you soon.